If you're dealing with pelvic floor dysfunction, chances are your pelvic floor and surrounding muscles are holding a lot of tension. This tension can build up over time and contribute to symptoms like pain, urgency, frequency, or general discomfort. The problem is that many people focus on strengthening, when in reality the pelvic floor often needs the opposite, to relax and let go. In this video, I'll walk you through 10 of the most effective stretches to help reduce pelvic tension, improve mobility, and support recovery. As you go through these stretches, try to incorporate slow, diaphragmatic breathing, letting your belly expand on the inhale and soften on the exhale. Number 1, Child's Pose. This stretch gently lengthens the lower back, hips, and pelvic floor. Start on your hands and knees. Bring your big toes together and let your knees fall apart. Slowly sit your hips back toward your heels. Rest your forehead on the ground and let your arms relax forward. Focus on slow breathing and allow your pelvic area to soften with each exhale. Number 2, Happy Baby Pose. This position opens the hips and provides a direct stretch to the pelvic floor. Lie on your back and bring your knees toward your chest. Grab the outside of your feet or your ankles. Let your knees fall wide and gently pull them down toward the floor. Keep your lower back relaxed and avoid forcing the stretch. Number 3, Deep Squat. This is one of the most natural positions for pelvic floor relaxation. Stand with your feet slightly wider than shoulder width. Slowly lower yourself into a deep squat. Keep your heels on the ground if possible and rest your elbows against your knees. Stay relaxed and breathe deeply. Number 4, Reclining Bound Angle Pose. A very gentle and passive stretch for the inner thighs and pelvic region. Lie on your back and bring the soles of your feet together. Let your knees fall out to the sides. Place pillows under your knees if needed for support. This is a great position to hold for a longer time while focusing on relaxation. Number 5, Butterfly Stretch. This stretch targets the inner thighs and helps release pelvic floor tension. Sit on the floor and bring the soles of your feet together. Let your knees fall outward to the sides. Sit tall and gently lean forward if comfortable. Keep movements slow and focus on relaxed breathing. Number 6, Low Lunge, Hip Flexor Stretch. This stretch releases tight hip flexors, especially if you sit a lot. Step 1 foot forward into a lunge position. Lower your back knee to the ground. Gently push your hips forward while keeping your torso upright. You should feel a stretch in the front of the hip on the back leg. Number 7, Seated Hamstring Stretch. This stretch helps release tension in the back of the legs and lower body. Sit with both legs extended straight in front of you. Keep your back long and slowly lean forward from the hips. Reach toward your shins or feet without rounding aggressively. Hold the position and breathe slowly into the stretch. Number 8, Knee to Chest. A simple and effective way to relax the lower abdomen and pelvis. Lie on your back and bring both knees toward your chest. Wrap your arms around your legs and gently pull them in. You can stay still or rock slightly side to side. Number 9, Seated Wide Forward Bend. This helps open the hips and inner legs in a gentle way. Sit with both legs extended wide in a V shape. Keep your back long and slowly lean forward from the hips. Place your hands on the floor or legs for support. Stay relaxed and avoid forcing the stretch. Number 10, Cat-Cow Stretch. Helps improve coordination between your spine, breath, and pelvic floor. Start on your hands and knees. On an inhale, drop your belly and lift your head slightly. On an exhale, round your back and tuck your chin. Move slowly and smoothly between the two positions. Honorable mentions. There are also a few other stretches that can be helpful depending on your specific symptoms. Pigeon Pose, Seated Twist, Lying Hamstring Stretch, Adductor Stretch, Cobra Pose. These stretches can be a powerful way to reduce tension and help your body start letting go. But for most people, stretching alone isn't enough to fully resolve symptoms. Recovery often requires a more holistic approach, looking at stress, the nervous system, how you respond to symptoms, and reducing anxiety and fear. If you combine these stretches with that bigger picture, you give yourself a much better chance of actually improving. I used to struggle with pelvic pain and constant urgency too, so I built Senavita to help others recover. Senavita includes psychological support using pain reprocessing and metacognitive therapy, guided stretches to relax the pelvic floor, expressive journaling to release built-up emotions, my recovery story and practical lessons for daily life, visualization meditations to calm your nervous system and ease symptoms. Track your symptoms, take assessments, and explore a full library of recovery resources. Download Senavita today and start your recovery.